Hi, Del Mar staff. It is Dr. Becca here. I'm sitting in our lovely orange room at our Jacksonville Henderson Road Clinic. I wanted to take a couple minutes and talk about something that I think is really important to us as caregivers, whether we are talking about caregiving in a professional role, the way that we do with our kids here at the clinic, or whether we're talking about parenting as caregiving. And that is the idea of compassion fatigue. The idea of compassion fatigue is when we are constantly caring for others in one capacity or another, we have learned to put their needs first before ours. And while that can be a wonderful thing for the people that we care for, it can be detrimental for us when it reaches a level of fatigue. And oftentimes, essentially, compassion fatigue is chronic stress that begins to have a negative impact on our own functioning. And as you know, I say all the time that we cannot serve from an empty vessel, and compassion fatigue can be considered the same as burnout, right? In that we are less effective at our job of giving care because our own cup is so empty. And so some of the things we want to look out for is typical signs of stress. So having a difficult time sleeping, or wanting to sleep too much, or apathy, right? Not really caring as much as we did before about the person we're caring for, but also about other things in our life. Changes in eating habit. For some people it's eating more, and for other people it's eating less. Decrease in physical activity, irritability. These are signs of chronic stress and may be indicative of burnout or compassion fatigue. Compassion fatigue happens when we are passionate about the people that we're helping and the work that we're doing. It is easy to understand how we pour so much of ourselves into what we do. And we want to continue doing that while also maintaining a reserve to take care of ourselves. And so the first step in understanding compassion fatigue is just awareness. And if you have any idea or suspicion that you might be experiencing some of these signs of compassion fatigue, you probably are. And I would encourage you to either, if you're an employee, to reach out and talk to your supervisor. And if you're a parent, to reach out to your support group, whatever that looks like for you, whether it's a formal support group or a social support network, but reach up and out and get some additional support to fill your own cup. Part of being a good RBT or therapist or BCBA or parent is taking care of yourself. I've joked with parents that have a hard time finding time for themselves that I will write them a prescription for a massage, or to go to bed earlier, to take a nap for themselves, or to get an extra day of respite and really use that time to take care of yourself, rejuvenate yourself, fill back up so that you're able to care for your child or your clients. So if you're noticing compassion fatigue or some of these signs, or you're thinking that you might, definitely reach up and out. Pull in that support system, whatever that looks like for you in the setting that you're in. And then really spend time taking care of yourself. Little things, drinking enough water. I mean, we are 70-some% water, and so we need to have plenty of water to function. Eating quality food. Taking the time to eat. Maybe we aren't eating enough, or we're eating junk, right? Adding a multivitamin in. Getting enough sleep. Prioritizing your life, right? We can do anything, but not everything. And so really prioritize what must be done and get that done. And then some things may not get done, and that's okay, because when you've prioritized, you know that the most important stuff has gotten completed. We also want to use those respite hours or babysitting hours, or ask someone to stay with your child so that you can have the time to do these additional tasks that are really needed to take care of yourself. Or if you're an employee, maybe you need to take a day off, or ask for your caseload to be reduced for a period of time till you can build back up. Because when not addressed, compassion fatigue worsens. And it's essentially when we are so compassionate and supporting other people that we're not able to get our own needs met. And it becomes like a chronic stress response. And we know from years of research that chronic stress has negative effects on the body, both physically as well as our emotion. And again, if we have to be in good working order across all domains to be able to care for others, whether it's to parent them or to work with kids, we must take care of ourselves so that we are in good working order to be able to take care of the kids that are depending on us for care. Again, this is just a short video about compassion fatigue. There's no shame in it. When we are passionate, it's kind of the double-edged sword that it can be hard to find balance, and that when we are caring for those who have a difficult time caring for themselves, that we are at risk from caring too much, and that we want to continue to care. And to be able to do that and provide quality support, we have to do that from a full vessel, right? We have to practice good self-care. So if you have any questions, feel free to reach out to your support network. You can also do a Google search and go to compassionfatigue.org that has lots of information about compassion fatigue. Thanks so much.